Hello and welcome to Pregnancy Info. Today we will discuss heavy menstrual bleeding or menorrhagia. Menorrhagia is menstrual bleeding that lasts more than 7 days. It can also be bleeding that is very heavy. If you need to change your tampon or pad after less than 2 hours, or you pass clothes the size of a quarter or larger, that is heavy bleeding. If you have this type of bleeding, you should see a doctor. Untreated heavy or prolonged bleeding can stop you from living your life to the fullest. Here we will discuss the causes of this problem. Possible causes fall into these categories. Number 1. Uterine-related problems. Growths or tumors of the uterus that are not cancer. These can be called uterine fibroids or polyps. Cancer of the uterus or cervix. Certain types of birth control, for example, an intrauterine device. Problems related to pregnancy such as a miscarriage or ectopic pregnancy can cause abnormal bleeding. Hormone-related problems can also cause heavy bleeding during menstruation. Other illnesses or disorders, bleeding related to disorders such as VWD or platelet function disorder, non-bleeding related disorders such as liver, kidney or thyroid disease, pelvic inflammatory disease, and cancer. Here are some signs of menorrhagia. You might have some of these or all of these. Have a menstrual flow that soaks through one or more pads or tampons every hour for several hours in a row. Need to double up on pads to control your menstrual flow. Need to change pads or tampon during the night. Have menstrual periods lasting more than 7 days. Have a menstrual flow with blood clots the size of a quarter or larger. Have a heavy menstrual flow that keeps you from doing the things you would do normally. Have constant pain in the lower part of the stomach during your periods. Are tired, lack energy, or are short of breath. Diagnosis. Finding out if a woman has heavy menstrual bleeding often is not easy because each person might think of heavy bleeding in a different way. Usually menstrual bleeding lasts about 7 to 5 days and the amount of blood lost is small. However, women have menorrhagia usually bleed for more than 7 days and lose twice as much blood. If you have bleeding that lasts longer than 7 days per period or is so heavy that you have to change your pad or tampon nearly every hour, you need to talk with your doctor. He will ask some questions. For example, how old were you when you go to your first period? How long is your menstrual cycle? How many days goes your periods usually? How many days do you consider your periods to be heavy? How does your periods affect your quality of life? After this diagnosis, some tests may also be recommended. For example, blood test. In this test, your blood will be taken using a needle. It will then be looked at to check for anemia, problems with the thyroid, or problems with the way the blood clot. Pap test. For this test, cells from your cervix are removed and then looked at to find out if you have an infection, inflammation, or changes in your cells that might be cancer or might be cause cancer. Endometrial biopsy. Tissue samples are taken from the inside lining of your uterus or endometrium to find out if you have cancer or other abnormal cells. You might feel as if you were having a bad menstrual cramps while the test is being done, but it doesn't take long and pain usually goes away when the test ends. Ultrasound. This is a painless test using sound waves and a computer to show what your blood vessels, tissues, and organs look like. Your doctor then can see how they are working and check your blood flow. Sonohysterogram. This ultrasound scan is doing after fluid is injected through a tube into the uterus by way of your vagina and cervix. This lets your doctor look the problem in the lining of the uterus. Mild to moderate cramping or pressure can be felt during this procedure. Hysteroscopy. This is a procedure to look at the inside of the uterus using a tiny tool to see if you have fibroid, polyps, or other problems that might be causing bleeding, dilation, and curettage. This is a procedure that can be used to find and treat the cause of bleeding. During a D&C, the inside lining of your uterus is scraped and looked at to see what might be cause the bleeding. Treatment. The type of treatment you get will depend on the cause of your bleeding and how serious it is. Your doctor also will look at things such as your age, general health, and medical history. How will you respond to certain medicines, procedures, or therapies? Drug therapy. Drug therapy includes some medicines like iron supplements to get more iron into your blood to help it carry oxygen if you show signs of anemia. Ibuprofen to help reduce pain, menstrual cramps, and the amount of bleeding in some women, and NSAIDs can increase the risk of bleedings. Birth control pills to help make periods more regular and reduce the amount of bleeding. Intrauterine contraceptions to help make periods more regular and reduce the amount of bleeding through drug releasing devices placed in the uterus. Hormone therapy to reduce the amount of bleeding, drugs that contain estrogen and or progesterone. Desmoressin nasal spray to stop bleeding in people who have certain bleeding disorders such as VWD and mild hemophilia by releasing a clotting protein or factors stored in the lining of the blood vessels that helps the blood to clot and temporarily increasing the level of these proteins in the blood. Antifibrinolytic medicines to reduce the amount of bleeding by stopping a clot from breaking down once it has formed. Another treatment is called surgical treatment. In this treatment, doctor may do dilation and curettage, a procedure in which the top layer of the uterus lining is removed to reduce menstrual bleeding. This procedure might need to be repeated over time. Operative hysteroscopy, a surgical procedure using a special tool to view the inside of uterus that can be used to help remove polyps, fibroids, correct abnormalities of the uterus and remove the linings of the uterus to manage heavy menstrual flow. Endometrial ablation or resection, two types of surgical procedures using different techniques in which all or part of the lining of the uterus is removed to control menstrual bleeding. While some patients will stop having menstrual periods altogether, others may continue to have periods but the menstrual flow will be lighter than before. Although the procedures do not remove the uterus, they will prevent women from having children in the future. Hysterectomy, a major operation requiring hospitalization that involves surgically removing the entire uterus. After having this procedure, a woman can no longer become pregnant and will stop having her period. Menorrhagia is common among women, but many women do not know that they can get help for it. Heavy bleeding is one of the most common problems women report in their doctor. It affects more than 10 million American women each year. This means that about 1 out of every 5 women has it. So be aware about this problem and must share this information with the women who are suffering with menorrhagia. And if you find this video useful, then like it, share it, and also subscribe our channel. Thank you.